The prostate. It's small, unassuming, about the size of a walnut. But for those who have one, this tiny organ could be the difference between a healthy life and a silent battle. Each year, nearly 1.4 million people worldwide receive devastating news: a prostate cancer diagnosis. Men, transgender women, non-binary individuals, and intersex people with biologically male organs. No one is exempt. It's a silent enemy, hidden in the shadows, waiting to strike. The worst part? In its early stages, prostate cancer shows no clear symptoms. It can be there, growing slowly, while you go about your daily life, completely unaware. But what if I told you there's a way to be proactive? To know if you're at risk? Understanding the symptoms and risk factors could save your life or that of someone you love. But before we dive in, are you subscribed? If not, this is the perfect moment. Click subscribe and activate the notification bell. That way, you won't miss our upcoming videos filled with valuable information you need to know. Join us in this video and discover how you can protect yourself. Because yes, the prostate is small, but your life is immense. The prostate is a small yet vital gland in the male reproductive system, with a role in the body that goes far beyond what many imagine. Picture something about the size and shape of a walnut, located just below the bladder, encircling the urethra, the channel that carries urine out of the body. At first glance, it may seem like a small and unimportant organ, but its function is essential for reproductive health and the overall well-being of individuals with male sex organs. The prostate produces a special fluid that, though discreet, plays a crucial role. This fluid is responsible for sustaining and nourishing sperm during ejaculation, making up a significant part of semen. Beyond its role in reproduction, this fluid contains elements that protect sperm on its journey to the egg, neutralizing the acidic environment of the urethra and increasing the chances of fertilization. However, the prostate has an unusual trait that many people don't know. It grows over time. During adolescence, this gland reaches a stable size, but once adulthood arrives, it continues to expand slowly. For some, this growth is harmless, but for others, it can become problematic, affecting basic functions such as the ability to urinate with ease and without discomfort. This enlargement, known as benign prostatic hyperplasia, BPH, is one reason why prostate health is essential. The answer is simple. A healthy prostate allows for a life free of urinary issues, free from lower pelvic pain, and free from complications that may arise with age. Furthermore, if left undetected, prostate issues can lead to serious conditions such as infections, inflammation, or even prostate cancer, one of the leading causes of death in older men. The key is prevention and awareness. Knowing the function and needs of this small gland keeps us one step ahead. It's not just about waiting for symptoms. It's about taking preventive measures to maintain prostate health and overall well-being throughout life. Prostate cancer is no minor issue. In fact, it's one of the most common types of cancer worldwide. Globally, approximately 1.4 million new cases of prostate cancer are diagnosed each year, and it ranks as the second leading cause of cancer death among men in many regions. This means that regardless of country, race, or lifestyle, prostate cancer affects millions of people and their families across all continents. To provide a clearer perspective, it is estimated that 1 in 9 people with a prostate will be diagnosed with prostate cancer at some point in their lives. This statistic includes not only cisgender men, but also transgender women, non-binary people, and intersex individuals with male sex organs. Although prostate cancer can affect people of all ages, it is much more common in those over 50. More than half of cases occur in people over 65. This type of cancer has become a public health issue that requires attention and awareness, as its incidence continues to rise as life expectancy increases worldwide. Despite its high frequency, it's worth noting that when detected early, prostate cancer has a very high survival rate. In fact, the 5-year survival rate for cases diagnosed before cancer spreads to other parts of the body is approximately 97%. This means that early detection and awareness of risk factors can make a tremendous difference in the lives of millions of people. With these figures in mind, it's essential to pay attention to prostate health, not only as a personal issue, but as a global health concern affecting communities, families, and entire generations. To understand the risk of developing prostate cancer, it's essential to know the factors that can increase the likelihood of this disease. Although having one or more risk factors doesn't guarantee you'll develop prostate cancer, it does increase the possibility, making it critical to stay informed. Let's look at the most significant risk factors. One of the most compelling factors is genetics. If you have close relatives, such as a father, brother, or son, who have been diagnosed with prostate cancer, your risk of developing it doubles or even triples. This is due to hereditary genetic mutations that can increase the likelihood of cancer, not just in the prostate, but in other organs. Examples of these mutations include the BRCA1 and BRCA2 genes, which are also linked to breast cancer. Age is one of the most significant risk factors. Prostate cancer is much more common in people over 50, with the majority of diagnoses in men over 65. This is because prostate cells, like many other cells in the body, become more susceptible to mutations over time. The older a person is, the greater the chances of a mutation leading to cancer. Statistics indicate that prostate cancer risk varies considerably by race. For example, men of African descent have a higher incidence of prostate cancer and are more likely to experience more aggressive forms of the disease compared to men of other races. Through proactive attention to these factors, we can take significant strides toward better prostate health, benefiting not just individuals but communities globally. In contrast, men of Asian or Hispanic origin are less likely to develop prostate cancer. The genetic and environmental factors behind these differences are under study, but it's essential to be aware of this trend and remain vigilant for symptoms. Weight and obesity. Obesity not only increases the risk of prostate cancer, but has also been associated with more aggressive forms of the disease and lower survival rates. This may be due to the fact that excess body fat can lead to chronic inflammation and hormonal changes, which in turn might promote the development and progression of cancer. Maintaining a healthy weight and engaging in regular physical activity are effective ways to reduce this risk. Smoking. Although smoking is more closely associated with lung cancer, research has shown that it also increases the risk of developing aggressive prostate cancer. Smoking impacts the immune system and exposes the body to numerous carcinogens, which can lead to mutations in prostate cells. Studies also indicate that smokers who develop prostate cancer have a higher risk of dying from this disease compared to non-smokers. Dietary and lifestyle factors. While the relationship between diet and prostate cancer isn't fully understood, some studies suggest that a diet high in saturated fats and low in fruits and vegetables may increase risk. For example, excessive consumption of red meat and high-fat dairy products has been linked to a higher risk of prostate cancer. Conversely, a diet rich in fruits, vegetables, and whole grains appears to have a protective effect. Consuming foods with antioxidant and anti-inflammatory properties, such as tomatoes, rich in lycopene, and broccoli, could be a preventative strategy. Exposure to chemicals. Exposure to certain workplace chemicals, such as Agent Orange, used during the Vietnam War, has been linked to an increased risk of prostate cancer. Although this risk affects a small group of people, it's important to know this factor if one has ever been in contact with toxic substances or works in industries with chemical exposure. Warning signs and symptoms of prostate cancer. 1. Difficulty initiating urination. This is one of the earliest signs that something may be happening in the prostate. It manifests when someone feels an intense, urgent need to go to the bathroom, but when trying to urinate, the flow doesn't begin immediately. This pause can be frustrating and unsettling, as despite the urgency, the body doesn't seem to respond as usual. The delay in starting the flow may vary in duration and frequency, but if it persists, it's a signal worth paying attention to, as it may be related to prostate enlargement or a partial blockage in the urethra. This symptom mainly occurs because as the prostate enlarges, it puts pressure on the urethra, the tube that carries urine from the bladder to the outside. When the urethra narrows, due to this compression, urinary flow is affected, making it harder to start urination. In mild cases, it may feel like a brief pause, while in more advanced cases, the effort to start the flow can be uncomfortable or even painful. The strain placed on the bladder to overcome this blockage can result in a feeling of incomplete emptying and the need to go to the bathroom more frequently, disrupting daily comfort. Aside from physical discomfort, difficulty initiating urination can have a significant emotional impact. People experiencing it may feel anxious or frustrated, especially if the situation occurs in public places or during urgent moments. The inability to urinate quickly and efficiently can lead some to avoid certain places or feel uncomfortable in social situations. This can affect quality of life and emotional well-being, emphasizing the importance of consulting a healthcare professional to address this symptom in a timely manner and prevent the problem from worsening. 2. Weak or intermittent urine flow. This is another common symptom for people experiencing prostate issues. When the gland enlarges, either due to benign prostatic hyperplasia or the development of abnormal cells, it puts pressure on the urethra. This makes the urine flow weaker than usual or even causes it to stop and start intermittently. Unlike a continuous flow, a weak or interrupted stream can make urination slow and frustrating, impacting comfort and creating a sensation of incomplete emptying. This irregular flow not only disrupts the act of urinating, but also leaves the person feeling a constant need to return to the bathroom, as the bladder may not fully empty in one attempt. This symptom tends to worsen over time, becoming more apparent as the urethral blockage increases. The struggle to maintain a constant flow can turn urination into a prolonged and bothersome process, affecting daily routines and, in some cases, leading people to reduce their fluid intake to avoid spending excessive time in the bathroom. In addition to the physical impact, this issue can also have emotional and social repercussions. Feeling dependent on a bathroom or experiencing discomfort and anxiety in public spaces is common among those with weak or intermittent urine flow. The fear of not being able to urinate adequately at inconvenient times or places can lead to progressive isolation, affecting quality of life and self-esteem. For this reason, any persistent change in urine flow should be evaluated by a specialist to rule out serious prostate problems and receive proper treatment to help restore quality of life. 3. The sensation of a full bladder after urination is a frequent symptom among people with prostate issues and can be quite frustrating. Those who experience it feel, even after going to the bathroom, that there is still urine retained in the bladder. This symptom is not only physically uncomfortable, but also creates a sense of dissatisfaction when urinating, as it seems that the body hasn't completed the emptying process. This persistent discomfort often leads the person to return to the bathroom repeatedly in an attempt to release the remaining urine, without achieving the desired relief. The primary cause of this sensation is usually prostate enlargement, which compresses the urethra and restricts the flow of urine. As a result, the bladder cannot fully empty in a single attempt. This partial obstruction not only hinders free flow, but can also cause the bladder to become more irritable and less efficient. Over time, the accumulation of residual urine can even lead to urinary infections, as the warm, moist environment favors bacterial growth. If this symptom becomes constant, it can have a direct impact on overall urinary health. Besides physical effects, the sensation of a full bladder also affects emotional well-being and quality of life. The need to return to the bathroom multiple times interferes with daily activities, causing disruptions at work, in social relationships, and during sleep, especially if it happens at night. Many people end up limiting the amount of liquids they consume to try to reduce the frequency of these episodes, which isn't always effective and may compromise adequate hydration. For these reasons, the sensation of a full bladder should be evaluated by a specialist who can determine its cause and propose appropriate treatment to relieve this bothersome symptom. 4. Frequent urination during the night, nocturia, is a common symptom in people with prostate issues and is often one of the first signs that something is amiss in the urinary system. Nocturia manifests as the need to get up several times in the middle of the night to urinate, interrupting sleep and causing discomfort. This symptom can be particularly bothersome, as it affects sleep quality and, consequently, overall well-being. Although many people attribute it to aging or increased fluid intake before bed, it can actually be a warning sign that the prostate is putting pressure on the bladder, reducing its capacity to retain urine. This nighttime urgency has a clear physical cause. Prostate enlargement can compress the urethra and reduce bladder capacity, causing it to fill up faster and triggering a frequent need to empty it. During the day, the individual may notice this urgency less frequently because they are active and can better control urination habits. However, at night, when the body is at rest, this pressure on the bladder becomes more noticeable, and the need to urinate repeatedly interrupts sleep. This not only causes physical discomfort, but can also affect mood and energy levels during the day, as accumulated sleep loss has a direct impact on mental and physical health. In addition to nighttime interruptions, nocturia may lead to restrictive habits, such as limiting fluid intake in the afternoon or evening to avoid frequent nighttime urination. However, this is not always an effective solution and may affect adequate hydration. Persistent nocturia, therefore, is a symptom that should be evaluated, especially if accompanied by other urinary signs. Consulting a doctor to investigate the cause of nocturia is essential to identify prostate problems or other health conditions that may be behind this symptom, allowing for appropriate treatment to improve quality of life and rest. 5. Pain or burning during urination, dysuria, is a symptom that may indicate that something is not right in the urinary system or in the prostate itself. This burning sensation is typically felt during urination and is an uncomfortable experience that interferes with daily well-being. Dysuria may occur sporadically, but when it becomes persistent, it is a clear sign that the prostate or urinary tract is irritated or inflamed, which can be related to various conditions, such as urinary infections, prostatitis, inflammation of the prostate, or even an enlarged prostate. Inflammation in the prostate compresses the urethra and makes it difficult for urine to pass through, causing painful friction that translates into a burning sensation. As the inflammation or obstruction worsens, the pain may intensify, making urination an increasingly unpleasant process. Moreover, dysuria may be accompanied by other symptoms, such as urinary urgency, pelvic pain, or frequent need to urinate, which significantly affect the quality of life of those who experience it. While people often attribute dysuria to temporary infections, its persistence or recurrence requires medical attention to rule out more serious underlying conditions. It's important to remember that dysuria is not exclusive to prostate cancer, but it can be an indicator of prostate problems, so it shouldn't be ignored. Timely diagnosis can identify whether dysuria is caused by an infection, benign prostate growth, or a more severe condition. Addressing the issue from the beginning not only helps alleviate discomfort, but also allows for treatment of potential causes before they progress. Consulting a doctor is essential, as appropriate treatment can help restore well-being and prevent future complications in the urinary system. 6. Pain in the lower pelvic area or around the prostate. This is a symptom that many people associate with advanced prostate problems. It generally manifests as a feeling of pressure or deep discomfort in the pelvic area, which intensifies when sitting for prolonged periods. An inflamed or enlarged prostate exerts pressure on surrounding tissues, causing this type of localized pain. Although intensity may vary, persistent discomfort is a sign that something may not be functioning properly in the prostate. Beyond the pelvic area, this pain can radiate to nearby areas such as the lower back, thighs, or even the perineum, the area between the rectum and genitals. This expansion of pain happens because the nerves in the pelvic region are interconnected, making discomfort in the prostate affect other areas. The person may experience pain that comes and goes, but it intensifies during certain activities, like sitting or lifting heavy objects. In advanced cases, this pain can interfere with daily activities, affecting mobility and overall comfort. Pelvic pain is not exclusive to prostate cancer. It can also occur in cases of prostatitis or benign prostatic hyperplasia, BPH. However, any persistent or worsening pelvic pain warrants a medical evaluation. Ignoring this symptom could delay the diagnosis of a condition that, if treated in time, can be effectively managed. 7. Pain during ejaculation. This symptom may go unnoticed initially, but could indicate problems in the prostate. People who experience it feel discomfort or even sharp pain during ejaculation, making the sexual experience uncomfortable and concerning. This symptom may be related to inflammation of the prostate, known as prostatitis, or an abnormal enlargement of the gland. As the prostate becomes inflamed or grows, it exerts pressure on the ducts and tissues involved in ejaculation, causing pain during an experience that should typically be pleasurable. The impact of this pain goes beyond the physical. It directly affects the sexual and emotional life of the person. Anticipating this pain can create anxiety, leading some to avoid sexual activity, which can result in frustration, low self-esteem, and relationship issues. This avoidance can impact emotional health, as sexual quality of life is a significant aspect of overall well-being. Ignoring this symptom can lead to recurrent pain and a constant sense of dissatisfaction in sexual life. The appearance of pain during ejaculation is a clear sign that the prostate needs evaluation. Although this symptom isn't always related to prostate cancer, it can indicate inflammation or prostate enlargement that needs treatment. Consulting a specialist is essential, as it allows identification of the underlying cause and appropriate treatment to relieve the pain and restore a healthy sexual life. Early diagnosis not only helps manage this symptom, but also provides an opportunity to address any prostate issues before they progress, enhancing quality of life on multiple levels. 8. Blood in semen or urine. Known as hemospermia and hematuria, respectively, this is a sign that may indicate significant prostate problems and should be taken as a serious warning. Although finding blood in semen or urine can be alarming, this symptom isn't always indicative of cancer. However, its appearance warrants immediate medical evaluation, as it may signal inflammation, infection, or abnormal growth in the prostate. Blood in these fluids appears because blood vessels around the prostate are affected by pressure or inflammation, causing small ruptures and leaks. In addition to being visually alarming, blood in semen or urine affects the emotional and mental well-being of those who experience it. As a noticeable symptom, it generates anxiety, worry, and fear, especially if it occurs repeatedly. People experiencing this symptom may feel uncomfortable in intimate situations, fearing that their partner might notice the problem or worry that it's linked to a serious illness. This constant worry can add additional stress and affect quality of life, particularly if the person decides to avoid sexual activity or restrict fluid intake to minimize urination. It's crucial not to ignore the presence of blood in semen or urine, as it may be an early sign of a prostate condition that requires medical attention. Besides cancer, it may be associated with urinary tract infections, prostate stones, or even injuries to the bladder or kidneys. 9. Pain in the lower back, hips, or thighs. This symptom can indicate that prostate cancer has progressed and spread beyond the prostate gland. As cancer advances, cancer cells may migrate to nearby tissues and bones, particularly affecting the pelvic area and lumbar spine. This pain isn't just an occasional annoyance. It's typically persistent and characterized by deep stiffness or a dull ache that may worsen over time. Constant discomfort in the lower back or hips is a clear sign that something more serious may be happening. In addition to pain, this symptom can restrict the mobility of the person experiencing it, making daily activities such as walking, climbing stairs, or standing for extended periods more difficult. Stiffness in the hips or thighs in particular can reduce flexibility and limit the ability to perform basic movements, significantly impacting quality of life. Over time, the pain may become more intense and prolonged, disrupting sleep and causing both physical and emotional fatigue. This situation may lead the person to reduce daily activities and depend on pain relievers, which only provide temporary relief. Persistent pain in the lower back, hips, or thighs should not be ignored, as it may indicate bone metastasis, a common complication in advanced prostate cancer. Consulting a doctor for a detailed evaluation allows identification of whether the pain is related to cancer spread and establishment of an appropriate treatment plan. With early and suitable treatment, it's possible to reduce pain, improve mobility, and control cancer progression, helping to maintain the best possible quality of life for the affected person. 10. Loss of bladder or bowel control. This serious symptom generally appears in the advanced stages of prostate cancer or in cases of significant prostate enlargement. As cancer or prostate enlargement progresses, it may begin to press on the nerves and tissues that control bladder and bowel functions. This pressure affects the ability to control emptying, potentially resulting in urinary incontinence or even difficulties in controlling bowel movements. This symptom is not only physically uncomfortable, but also has a significant emotional impact, affecting the person's independence and quality of life. Urinary incontinence can present in various ways, from small urine leaks when coughing or exerting effort to complete inability to retain urine. On the other hand, loss of bowel control, although less common, may also occur in advanced stages, leading to episodes of involuntary evacuation. These symptoms often cause anxiety, embarrassment, and stress as they impact social life and self-confidence. Many people may begin to avoid public activities for fear of accidents, affecting their emotional well-being and potentially leading to isolation. This symptom requires immediate medical attention, as it usually indicates that the cancer has spread to critical areas of the nervous system or that prostate enlargement has reached a severe level. Consulting a specialist is essential for conducting tests and evaluations to determine the cause and extent of the problem. There are treatments and strategies to manage these symptoms and improve quality of life, as well as options to control disease progression. Recognizing these symptoms and warning signs is crucial to act before the disease advances too far. Although many of these symptoms may be mistaken for normal signs of aging or less serious conditions, staying alert to body changes and seeking medical advice when persistent symptoms arise can make a big difference in prognosis. The key is to listen to the body and give it the attention it deserves to prevent or detect serious conditions like prostate cancer in a timely manner. Prevention and early detection of prostate cancer are essential for improving survival rates and reducing the impact of this disease on quality of life. Although there is no definitive way to prevent prostate cancer, certain habits and practices can reduce risk and aid in early detection. Adopting a healthy lifestyle and staying informed about personal risk factors are key steps in maintaining prostate health and anticipating potential problems. Maintaining a healthy weight is one of the factors that helps reduce prostate cancer risk. Obesity has been associated with more aggressive forms of this cancer, so adopting a balanced diet rich in fruits, vegetables, and whole grains is beneficial. Foods rich in antioxidants, such as tomatoes, which contain lycopene, broccoli, and nuts, may offer additional protection. Limiting the intake of red meats and processed foods also helps reduce risks, as these foods can increase inflammation levels in the body. Regular exercise is another factor that plays an important role in prevention. Physical activity not only helps maintain a healthy weight, but also reduces inflammation and improves the immune system, allowing the body to better combat abnormal cells. Research suggests that those who engage in at least 150 minutes of moderate exercise per week have a lower likelihood of developing aggressive prostate cancer. Additionally, avoiding smoking and moderating alcohol consumption are practices that reduce risk and promote better overall health. Early detection of prostate cancer is crucial, as this disease often shows no obvious symptoms in its early stages. Screening tests can identify problems before the cancer fully develops or spreads to other parts of the body. Common tests include the prostate-specific antigen, PSA, blood test, which measures levels of this protein in the body. High PSA levels can indicate prostate cancer, although they may also relate to other benign prostate conditions. The digital rectal exam, DRE, is another screening tool that doctors use to feel for possible irregularities in the prostate. Although this exam may feel uncomfortable for some, it is quick and allows the healthcare professional to evaluate for lumps, hardened areas, or irregular growth in the gland. The combination of the PSA test and DRE is particularly useful for detecting cancer in individuals with risk factors, such as a family history of prostate cancer. Those with a family history, especially if a father or brother has been diagnosed, have a higher risk of developing this disease and should consider beginning screenings at an earlier age. While most men start PSA and DRE screenings around age 50, those with a family history or who belong to high-risk groups, such as men of African descent, should start at age 40 or 45. A personalized screening plan developed in consultation with a doctor can help determine the appropriate frequency and type of exams for each person. Once screenings begin, regular follow-up is essential. A single elevated PSA test does not confirm the presence of cancer, as there are other causes that may increase its levels. If the doctor observes a gradual change or significant increase in PSA levels over time, they may recommend additional tests, such as an MRI or prostate biopsy, to obtain a more accurate diagnosis. Consistency in screenings helps healthcare professionals identify any significant changes and make informed decisions about treatment if needed. Prevention and early detection of prostate cancer require a combination of a healthy lifestyle, awareness of risk factors, and commitment to regular medical checkups. Although not all risk factors are modifiable, such as age or family history, adopting healthy habits and undergoing preventive tests are important steps to maintaining prostate health. Consulting a medical professional about the timing and frequency of screenings, as well as following a proper diet and lifestyle, are measures that make a significant difference in prevention and early diagnosis of prostate cancer. The outlook and prognosis for people with prostate cancer have improved significantly in recent decades due to advances in early detection, diagnosis, and treatment options. In general, the prognosis for prostate cancer is favorable, especially when detected in its early stages before it has spread to other parts of the body. In these cases, the 5-year survival rates are extremely high, reaching approximately 97%. This means that most patients with early diagnoses can live many years after receiving appropriate treatment and lead healthy lives. The prognosis also depends on the grade and stage of the cancer at the time of diagnosis. Slow-growing types of prostate cancer, which are the most common, can be managed with less invasive treatments, and in some cases, doctors recommend active surveillance, meaning monitoring cancer's progress without immediate treatments. This approach is used in low-risk cases, where the disease progresses so slowly that it may not significantly affect the patient's quality of life. This strategy allows people to avoid the side effects of more aggressive treatments and enjoy a good quality of life while keeping the cancer under control. For cases where the cancer has advanced or is aggressive, the prognosis may vary and depends on factors such as the patient's overall health, response to treatment, and the extent of the cancer. Treatment options include surgery, radiation therapy, hormone therapy, chemotherapy, or a combination of these, depending on the specific case. Although treating advanced prostate cancer can be challenging, current therapies have proven effective in slowing disease progression and improving quality of life. In some cases, advanced cancer may become a chronic condition managed over several years, allowing the patient to live with the cancer under control. Still, the importance of early detection is crucial for optimizing prognosis, as the earlier the diagnosis, the greater the chances of successful treatment. Prostate cancer is a disease that can be largely managed and prevented through good habits and a healthy lifestyle. Nutrition plays a fundamental role in reducing inflammation and strengthening the immune system, which can be key in preventing serious conditions, including this disease. A well-balanced anti-inflammatory diet can make a real difference in prostate health and overall health. Taking proactive steps for your prostate health is essential, and keeping your metabolism active is a key part of that journey. That's why we recommend Java Beans, an energy-boosting supplement designed to kickstart your metabolism and help you stay active. Whether you're just beginning your wellness routine or looking to take it up a notch, Java Beans can be your perfect daily boost. Also, we'd love to hear from you. What are some of your go-to habits for staying healthy? Let us know in the comments below. Remember to subscribe to The Wellness Insight, give this video a thumbs up, and share it to spread the word on health and wellness. Check out the link in the description to learn more about Java Beans and take control of your health, because prevention is key. And don't miss our next video, where we'll dive deeper into more tips for living your healthiest life.